Mr Hales has been here for 11 days now outside this combat stress treatment centre in Newport, Shropshire. This is your 11th day of fasting, isn't it,
Yes.
Gus? How are you feeling?
Pretty washed out, pretty tired, still lucid, still determined to go to Remembrance Day, but I feel myself getting weaker each day.
And you've been sleeping in that tent behind us. How's that been?
A former paratrooper, went through the Falklands War. Quite enjoy it in a strange sort of way.
And why did you feel you had to take these extreme measures?
Lots of reasons really, but we can see that treatment of veterans returning from combat is woefully inadequate. I think somebody said there was a suicide last night, which brings the yearly total to about 57, I believe. There was 14 in October, and I think it's 4 this month, November already. So the treatment just doesn't seem to be there. It doesn't seem to be together or packaged, and that's got to change. It's the 100th anniversary of the First World War since shell shock was first recognised. Today they call it combat-related PTSD, and things need to change.
What do you want to see change?
Maybe dedicated centres paid for by the government, because it was the government I was employed by, it was the government that sent me to war, and we seem to be farmed off to this charity, that charity, and the charity sector, I'm sure, tries its best, but it's not good enough.
The Defence Secretary last week announced £10 million to go to veteran mental health needs. What's your reaction to that?
Well, £10 million sounds a lot of money, but it's probably the wing of a jet fighter aircraft. So if you're going to send people to war, it costs billions. And the war doesn't just stop on the day of the ceasefire. When the guns go silent, it's a continuing war for a veteran. The sights and sounds and smells he's experienced will stay with him for the rest of his life. And
what symptoms are you experiencing? Of course, you've had an unreserved apology from combat stress for being discharged in 2015. What have been your struggles since then?
Really, after the discharge, I wrote to this organisation to ask why I was discharged. That still hasn't been answered. There's been an apology, but I still don't know why I was discharged. And according to the NICE guidelines, there should be a proper care discharge package, which I'm still waiting for. So I don't know where I am regarding this organisation who treated me for so long. I would like a discharge plan so I can take it perhaps to another organisation and say this is what they did for me, this is where I am. But although there's been an unconditional apology, I still have not got those answers.
Now, Gus, before we go, we must ask, you're breaking your fast on Sunday. What is your message to defence ministers and the MOD listening?
My message is basically this. All the great and the good will be in Whitehall on Sunday in front of the cenotaph. And there's 3 words on the cenotaph: our glorious dead. What about our glorious living? The dead, in many ways, we can't do anything for them. We can remember them, and that's what Remembrance Sunday is about. But our glorious living need help. They need the structures and support that when you put your life on your line, sign up for the country. Nobody's complaining about that, but please look after them when that comes to an end.
And when you break your fast on Sunday, what's it going to be?
Food-wise, I really don't know. Apparently, sort of Complans or that type of milkshake. I've got to take it easy, else I'll get cramps.
OK, well, look after yourself. Thank you very much for speaking to us.
Thank you.
As Gus said, people around the country will be remembering the fallen on Sunday. And Gus's efforts this week and last week is for people to remember those who carry on living with the burden of war.